What do you think of when you hear the words varicose veins? Probably an older woman, maybe even your grandmother.
But men and young women get them as well, young people, I should say. CBS 2's Dr. Max Gomez here now to tell us about the new techniques used to get rid of those ugly veins.
That's right, Maurice and Christine. You know, varicose veins and their smaller cousins, spider veins, are very common with age and more common in women. But they can occur in almost anyone, even as young as the late 20s, and especially if your job calls for being on your feet all day, like one man I interviewed.
I have spider veins on both of my legs, and it's actually hereditary. My grandmother had both varicose veins and spider veins, and my mom also has both varicose and spider veins.
That heredity is probably the #1 risk factor for bad leg veins, made worse by Jay Reyes' job. He's a flight attendant on his feet 16 hours a day, so no surprise that he's developed spider veins.
People started to notice them and would make comments on them, and then I just started wearing longer pants, even to like the beach or pool parties.
Spider veins and their bigger, uglier relatives, varicose veins, are caused by failing valves in leg veins, causing blood to back up, pool, and dilate those leg veins.
It also happens to men in a proportion of 10-to-1 or 20-to-1, much more frequent in women because of pregnancies and female hormones than in men.
The good news is that there are effective treatments for spider and varicose veins. Up to medium size, a technique called sclerotherapy is best. It's the injection of an irritating liquid or foam that causes the vein to close off. Watch as the tiny spider veins blanch and disappear as the fluid fills the veins.
It will take from 1 or 2 treatments to 10, 12, depending on the extent of your venous problem, how you heal, and how much perfection do you want.
Dr. Navarro thinks he's treating many more men recently because of his technique using cold air and vibration to make the injections almost painless.
Not painful at all. You would see it in the space.
Now, larger varicose veins require a laser fiber to heat the inside of the vein and close it off. But most veins can be done with injections, which cost about $500 for 40 shots. And one more reason doctors are seeing more bad veins, being overweight or obese. Christine?
All right, Dr. Max, thank you.